In the classification of tricuspid atresia, type 2 implies the great arteries are transposed. Which specific relationship is most common in this type? A. L-transposition, levotransposition. B. D-transposition, dextrotransposition. C. Double outlet right ventricle. D. Total anomalous pulmonary venous connection. Answer, B. D-transposition, dextrotransposition. What is the classic radiographic sign of type 2 tricuspid atresia with increased pulmonary blood flow? A. A narrow vascular pedicle, agonostring. B. A snowman heart. C. Pulmonary plethora, increased vascular markings. D. A scimitar sign. Answer, C. Pulmonary plethora, increased vascular markings. Which of the following is considered an absolute requirement for a patient to be a candidate for the Fontan procedure? A. Mean pulmonary artery pressure less than 15 mm of mercury. B. Presence of significant mitral regurgitation. C. Elevated end diastolic pressure in the single ventricle. D. Severe hypoplasia of the pulmonary arteries. Answer, A. Mean pulmonary artery pressure less than 15 mm of mercury. The Damas-K-Stansel (DKS) procedure is sometimes performed during the Glenn or Fontan stages for what purpose? A. To repair a cleft mitral valve. B. To bypass subaortic obstruction by connecting the pulmonary trunk to the aorta. C. To create a new tricuspid valve from pericardium. D. To close a large ASD. Answer, B. To bypass subaortic obstruction by connecting the pulmonary trunk to the aorta. Which physical sign might suggest a restrictive atrial septal defect in a neonate with tricuspid atresia? A. Prominent a wave in the jugular venous pulse. B. Hepatomegaly and poor systemic output. C. Loud S1. D. Both A and B. Answer, D. Both A and B. In tricuspid atresia, the oxygen saturation in the left ventricle is typically A. 100%. B. Equal to the saturation in the right atrium. C. Reduced due to obligatory mixing of systemic and pulmonary venous return at the atrial level. D. Lower than the saturation in the right ventricle. Answer, C. Reduced due to obligatory mixing of systemic and pulmonary venous return at the atrial level. What is the classic Glenn procedure, which differs from the bidirectional Glenn used today? A. Anastomosis of the SVC to the left pulmonary artery. B. Anastomosis of the SVC to the right pulmonary artery, end-to-end, disconnecting it from the main PA. C. Connection of the IVC to the pulmonary artery. D. Use of a prosthetic graft between the SVC and aorta. Answer, B. Anastomosis of the SVC to the right pulmonary artery, end-to-end, disconnecting it from the main PA. Patients with tricuspid atresia and a restrictive VSD are at risk for A. Pulmonary overcirculation. B. Inadequate pulmonary blood flow and worsening cyanosis. C. Systemic hypertension. D. Left to right shunting at the ventricular level. Answer, B. Inadequate pulmonary blood flow and worsening cyanosis. Why is the bidirectional Glenn preferred over a systemic to pulmonary shunt, like the BT shunt, for long-term palliation? A. It provides pulsatile flow to the lungs. B. It reduces the volume overload on the single ventricle. C. It eliminates the need for future surgeries. D. It can be performed safely in the first week of life. Answer, B. It reduces the volume overload on the single ventricle. On echocardiography, the absence of which of the following confirms the diagnosis of tricuspid atresia? A. A patent ductus arteriosus. B. An offset between the mitral and tricuspid valve insertions. C. Diastolic flow from the right atrium to the right ventricle. D. A ventricular septal defect. Answer, C. Diastolic flow from the right atrium to the right ventricle. Which genetic syndrome is occasionally associated with tricuspid atresia, though most cases are sporadic? A. Down syndrome, trisomy 21. B. 22q11.2 deletion syndrome, DeGeorge. C. Turner syndrome. D. Williams syndrome. Answer, B. 22q11.2 deletion syndrome, DeGeorge. What is the physiological consequence of a fenestrated Fontan on postoperative arterial oxygen saturation? A. It increases saturation to 98 to 100%. B. It results in slightly lower saturations, typically 85 to 90%. Due to a controlled right to left shunt. C. It has no effect on oxygen saturation. D. It leads to severe, life-threatening hypoxia. Answer. B. It results in slightly lower saturations, typically 85 to 90%, due to a controlled right to left shunt. The extracardiac conduit Fontan technique is often favored over the lateral tunnel because it A. Can be performed without a cardiopulmonary bypass. B. Results in a lower incidence of late atrial arrhythmias. C. Allows for the growth of the conduit over time. D. Does not require anticoagulation. Answer. B. Results in a lower incidence of late atrial arrhythmias. Which of the following drugs is often used long-term in Fontan patients to reduce the risk of thromboembolism? A. Aspirin or warfarin. B. Digoxin. C. Furosemide. D. Spironolactone. Answer. A. Aspirin or warfarin. If a child with tricuspid atresia develops sudden, worsening cyanosis and spelling, similar to tetralogy of Fallot, the most likely anatomical configuration is A. Type 2 with no pulmonary stenosis. B. Type 1 with a restrictive VSD and infundibular pulmonary stenosis. C. Type 3 with a persistent truncus arteriosus. D. Any case with a very large ASD. Answer. B. Type 1 with a restrictive VSD and infundibular pulmonary stenosis.